The Institute for Women's Health is a collaboration between University College London and University College London hospitals and aims to improve the care that we provide to women throughout their life, particularly in pregnancy, and for the care of sick newborn babies. The ethos of the Institute is for a broad range of researchers to work together to improve the care that we provide. And that will include researchers who do very basic scientific research in the laboratories, right through to population scientists who look at the impact of behaviour change or interventions at the population level. So the aim is to have a holistic approach to the research that we do, right from the laboratory to the bedside and beyond.
Neonatology is a really important part of the Institute for Women's Health. We focus on the sick or preterm newborn infant, and our overall aim is to reduce significantly the number of infants who have a bad outcome after birth asphyxia. And birth asphyxia is a starvation or lack of oxygen around the time of birth, and it is a very significant problem worldwide. In the developed world, there have been significant advances in treating birth asphyxia. We now have a safe and effective therapy, which is therapeutic hypothermia, which consists of cooling a baby very soon after birth by 3 degrees for 3 days. And this effectively treats 1 in 9 infants and stops them having an adverse outcome. Unfortunately, we don't know whether this is safe and effective in low-resource settings, such as Uganda. And it's for this reason that we have started the ABANA study to look at predisposing causes of neonatal encephalopathy.
The Institute of Women's Health at UCL has a number of collaborative partners in Uganda, one of which is Malago Hospital, and together they formed the Uganda Women's Health Initiative. At Malago Hospital, our work is very much focused on perinatal asphyxia. The work has involved both training and a research program looking at prevention and treatment of perinatal asphyxia and the brain injury that occurs as a result of perinatal asphyxia.
The positive outcomes I hope for from this research is to improve the management of babies who are affected by birth asphyxia plus or minus infection in Malago Special Care Unit and the country at large. My vision for the Uganda Women's Initiative is to see that we expand and move out of Malago and go elsewhere in this country.
The Institute has taken its first steps in terms of developing research which will benefit the populations in less well-developed parts of the world, and we're very keen to develop that much further. So I think we are pushing forward our global agenda. We'll go beyond Uganda and beyond Africa, I think, in terms of developing our research agenda.
Some of the high-tech, very scientific things that we do in the Department of Maternal Fetal Medicine here in the Institute is really only going to be relevant to a population which has access to high technology inputs. But some of the other things that we do really look at more fundamental things like the way we provide antenatal services to populations and how we engage with vulnerable groups of women who have poor outcomes.
Mum's Power project is about really improving antenatal care for women. It's about putting them in the centre of the care and making them feel an equal partner in the relationship with a healthcare provider. What we're starting to do is to talk to women about what they really want, so that rather than us as healthcare professionals deciding what women should have, we're asking women what they really want. And those give us very powerful stories to talk to clinicians about why we need to improve care and how we're going to improve care. But we're also talking to clinicians about what they feel is working well and what they feel could be improved. So hopefully we get something at the end of this project that's good for the clinicians and good for the women.
The work that goes on at the Institute at the moment is world-class, but we can better that. We can expand our horizons into population science research. We can ensure that our discoveries in the laboratory lead to improvements in the care of women, and we can expand our global horizons. The ultimate aim is to become one of the world's leading institutes for women's health.